Dominic Ochieng resides at Akadot Sub-County, Tororo District. His patch of green earth features a modest shamba that is well tended and dotted with fruit trees and pine that provides ample shade. On the day we visited his home, grief hung heavy over this kempt homestead, evident from Ochieng's downcast demeanor. Entombed in this grave are the remains of Ochieng's wife, who died alongside their infant son at Tororo General Hospital. Ochieng attempts to put on a brave face, but beneath the veneer, he cannot hide his pain and anguish. A fresh floral wreath lies on Aswan's grave in its humble setting, holding the last vestiges of her living years. Ochieng recounts what happened when he took his pregnant wife to Tororo Main Hospital on February 23, 2023.
So after reaching the hospital, my wife was admitted. After a while, a nurse asked me that they wanted some money. But I told them I didn't have money. I don't have money at the moment. So they asked me that go and do whatever you can do and at least get some money.
Patients have a right to impartial access to medical care in government health facilities, and in the event of a medical emergency, under the Hippocratic Oath, a person is entitled to receive emergency medical care unconditionally, without having to pay any deposits or fees prior to medical care. Written in antiquity, the principles of the Hippocratic Oath are held sacred by doctors to this day. Treat the sick to the best of one's ability, preserve patients' privacy, and teach the secrets of medicine to the next generation. Ochieng's account suggests that his wife was denied the right to health care at Tororo Main Hospital, and the consequences were fatal. The maternal mortality ratio for women aged 15 to 49 in Uganda is 368 deaths per 100,000 live births, compared to 438 deaths per 100,000 live births in 2011. Although this is against a target of 70 deaths per 100,000 live births. This significant decline notwithstanding, severe bleeding accounts for 1 in 4 maternal deaths globally, and in Uganda bleeding accounts for 46% of maternal deaths. There is evidence that the skill and diligence of health providers is decisive in preventing the loss of life. As such, Dominic Ochieng's ordeal brings the competencies of the health staff at Tororo Main Hospital into sharp focus. The post-mortem findings added credence to Dominic's account, as Joram Okok, a relative to the deceased and a councillor representing Morokatipe Sub-County, claims.
The post-mortem report came out from Bali and was pinning the hospital for negligence. As I speak, I'm saying I'm dragging the hospital to court. According to the mother who was attending to her, she was like, they wanted money, and she didn't have the cash at hand. So therefore, it delayed the whole process. Now, when they realized that the situation had so much deteriorated, is when now she was rushed to the theater. And unfortunately, it was too late. She couldn't make it.
Maternal deaths are common in the 200-bed ailing government facility in Tororo, which serves a catchment area of 500,000 people extending to the Kenya-Uganda border and beyond. The 6-bed labor suite is staffed by 2 to 3 birth attendants supervised by 1 to 2 physicians who can barely manage to attend to the scores seeking their services. The birth attendants collect patient information by filling out handwritten birth registers on admission and discharge. It is these hospital records that inform Joram Okok's sense of injustice.
The surgeon at Mbali, who was conducting a post-mortem, challenged the police detectives of Tororo to get back to the hospital and investigate that case, such that the duty roster was supposed to guide, such that those notes Actually, when the detectives, I went there with the detectives myself. We discovered that they now just attended to her. She went there by 8. The deceased, our Swan Elizabeth, the late.
It was just in the records.
Now she was now registered in the record by 1. From 8, can you imagine, up to 1. Those are 5 hours.
It was investigated and the file was taken to the office of the DPP, that is the resident state attorney in Tororo, and the office of the RIS advised that the matter should be handled administratively.
The labor suite at Tororo Main Hospital is where Francis Odoi, a nurse at Osukuru Health Center 3, took his wife, Mukisa Christine Maliza, a 34-year-old mother of 4, grappling with labor pains. The fresh grave site brings pain to Francis Odoi, who's still coming to terms with his loss. The sense of loss is palpable as he narrates his travails.
The wife get birth at outside the labor suit. When they get birth outside the labor suit, the people came there and gathered there. Too many people. They rush immediately. They carry the woman. They take the woman inside the labor suit. Again they call me. You come and go and buy that drug for stopping what? Bleeding. Reaching 6 p.m. They call me again. You come. Who that and that? Your wife has passed away.
Delays in receiving adequate treatment at health facilities increases the risk of maternal death. These delays are caused by shortages of medical supplies, equipment, and adequately trained health staff, which undermines the timeliness and quality of medical care available to expectant mothers. The inordinate delays Francis Odoi experienced at Tororo Main Hospital is symptomatic of the fragility of the public health system in a country where there is one employed skilled health professional for every 1,000 persons. Key to mitigating maternal death is to have more mothers giving birth in government health facilities. However, the evidence suggests more mothers are seeking services away from government facilities.
But when it comes to delivery, we are at around 65% of them delivering at our health facilities, which is still very low compared to the over 80% of national requirement.
Okongo Simon Peter, the LC1 chairperson for Nyake Central, reveals the dilemma advocates for public health services like him face.
Because through the local council, we are requested to sensitize and advise all women to go and get delivered from the hospital. And we always do that. Unfortunately, after them going to the hospital, the problem is there's no medicine.
Tororo Main Hospital has one operating theater with 2 rooms where this woman who spoke on condition of anonymity fled after she decided against having a cesarean section.
When I went into labor, I went to the hospital where they recorded my information. Then they asked me for 300,000 Ugandan shillings to operate me. I decided to flee the hospital.
I cannot confirm or deny that maternal death at our facilities can repel or can chase away mothers from our facilities. It could be one of the reasons, but that is, these deaths are not on a daily basis. People die once in a while, not really. And some of the mistakes we have realized was from us, and also some were from the mothers themselves.
Declining health budgets have led to a cyclical crisis peppered with acute staffing shortages of the health sector human resources, apathy, and despondency amongst poorly paid medical staff. George Olowo, the LC3 chairperson of Nyangole sub-county in Tororo, recounts his wife's experience at the hands of some medical workers at Tororo Main Hospital.
Remember, my own wife, this is a history of my own wife. She went to the hospital to get back. Reaching there, I think our time was reached. Now she carried everything. There was a Polten paper, mama kit. He carried them and some money. After giving the nurse the money for helping her, the nurse went to the room and disappeared. Now this woman started crying in the bed. Now the attendant is the one who went to her. And this attendant also start now crying. Then another nurse come in, the one with the goodie, Samantha, and said, what happened? Then she's the one who helped the what? Who helped the woman. Then after, then the mama said, this one has helped. But which nurse did you give the your things? The nurse just disappear with everything, Polten paper, mama kit, disappear with it. Then these people, they just pull another money to thank this person who has worked too, who has helped her.
This experience is echoed by Peter Okoth, a resident of Nyakesi, Zone A in Nyangole Sub-County in Tororo, who reveals that the practice of soliciting bribes and extorting vulnerable patients is rife. Okoth recounts how he only received treatment and care for his pregnant wife after parting with some money.
30,000 Uganda shillings. Then I told my sister, okay, the thing is, tell the nurse, it is now midday, but at around 1, I will reach there because I was almost leaving village, going to the hospital. But tell the nurse that I have 20,000 shillings cash. Then immediately I left village. I reached there. I found when they had injected her. Then to my, what annoyed me, the woman who was removed from the bed, that you get away, we shake your friends also. That woman passed away.
The payment of bribes that are demanded for on each visit to a health facility to access services is a common experience for people seeking healthcare in Uganda. On average, households pay 106,000 Uganda shillings in bribes to access healthcare. This is according to a 2021 study by the Inspectorate of Government. Typically, those who needed maternal services were asked to pay 15,000 shillings at a time. Juliet Ayo, a human rights activist based in Tororo, says the situation is dire for those in the lowest rungs of society.
According to the few women that I have interacted with, is some still say they ask them for monies to be attended to, and once they don't have the money, they may not be given that attention that they need, and out of that, others run away from the hospitals and resort to traditional birth attendants in the communities.
The motivation for paying bribes includes to gain access to quality health care, speed up a procedure, and get the services of a specialist.
We advocated for the doctors and the nurses to have name tags, such that when someone is asking you for monies that you cannot afford, at least when you're reporting to our offices, you are able to identify for us that either it was Musao Annette or it was Musao Rose who asked me for this money, such that the blame can be directed to the concerned party. But again, that one also is not working for them. They are not reporting some of these cases.
Simon Peter Okongo, the LC1 chairperson for Nyake Central, says this creates a situation where both the giver and receiver are guilty of corruption.
Maybe you take a name of a nurse or a doctor, you are making it worse because you are going there for a problem. You want a help, so you cannot again betray somebody. That so and so has asked me this amount of money. So it is hard.
Critically, staffing norms in public health facilities in Uganda have not been adjusted in light of a growing population, increasing the likelihood that staff are overworked. In this context, government efforts to increase the uptake of maternal health services in public facilities is undermined. Dr. Okoth Obo, the District Health Officer of Tororo District, reflects on the health-seeking behavior of pregnant mothers in Tororo in light of the quality of public health services.
But also I've talked about the traditional birth attendants who are still prevalent in our communities. They also have a way in which they treat our mothers, and the mothers prefer them to our midwives because for them they have personal touch. Their customer care, if I can put it that way, seem to be better than ours because our midwives are overwhelmed, they have a lot of work, they do not give personal attention to mothers. And these mothers need one-on-one care at times. because they are all they are different. There are those who are coming to deliver for the first time. There are those who have problems with deliveries. There are those who have social issues, psychosocial issues, economic issues. They need to be attended to.
But I know so that our population, some people still believe in traditional birth attendance. But also, our people lack knowledge. For someone to go to theater to be operated to save the mother, there is always a reason. Either the baby is tired, or the baby is big, cannot pass through, or the mother is getting tired.
Investment in the health sector has mirrored the trend of health-seeking behavior as more people seek services in the private health facilities. The government has prioritized investment in private health services, such as the Lobawa Hospital, where government doled out $379 million. A 2020 Supreme Court judgment found that the government's failure to provide health care for expectant mothers was a violation of their right to health and unconstitutional. Further, the court found that the government's failure to provide emergency services to expectant mothers in public health facilities, resulting in their injury and inhumane treatment, is unconstitutional. Court instructed the government to provide sufficient funds in the budget for maternal health care. This landmark ruling set a precedent as it arose from the lawsuit against the government following the death of two expectant mothers, namely Rhoda Kukiriza and Inziku Valente. Stephen Masiga, a researcher, cites these legal precedents when proposing remedies.
Normally, there is what they call strict liability offenses. Sanctions must have been imposed. Such persons must be, of course, if you lead to death of another person and you are paid by government to protect life, but apparently you are negligent and somebody loses life. This results into litigation. So where you have people suing government, where you have people suing Tororo district local government, and this context, we enjoin and encourage those who are aggrieved by the inefficiencies of the health staff in Tororo to take them on legally.
When trying cases where medical workers are charged with rash and negligent acts causing death, courts in Uganda typically make judgments based on the evidence from post-mortems, for example, that prove that the cause of death was due to the rash actions or negligence of the medical worker in question. This provides little to no solace for Dominic Ochieng and Francis Odoi, who may not have the means to hire a lawyer or understand the procedures to file a complaint before the Uganda Medical and Dental Practitioners Council, which will then sit and determine whether to sanction an inquiry. A dark cloud hovers over this hospital as the lives of expectant mothers continue to be put in harm's way. The situation at Tororo General Hospital and elsewhere contrasts sharply with the first world health facilities, where the political elite, their children and cronies receive treatment on taxpayers' money. This is a practice akin to medical apartheid, and as a practice, public watchdogs demand should stop.